Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CVCT of the patient which you had requested. The area of interest is the upper left 4 and the lower right 5, 6, and 7 regions. Starting with the upper left 4. This is the upper left 4. We've got a cavity and two canals, very wide and clear. We've got a periapical radiolucency developing here as well. This tooth is grossly carious, especially from the distal aspect, as you can see on this view right here. The axial view extreme cavitated, and as you move down you can see that there are two wide canals which have separate APCs very visible right here. There you go. So approximate working length is going to be for this tooth 20 millimeters, and if it is to be extracted we've got a ridge width of 11 and a ridge height of 17 millimeters. Now quickly moving to the lower right 5. The lower right 5 has a lesion, a class 2 lesion on the medial aspect, and then we've got ground away teeth, one single canal here, no periapical radiolucencies can be seen. This is the lower right 6. The lower right 6 shows us this is the mesial canal. The mesial canal shows us two obturated canals or radio-opaque material can be seen, and we can also see no radiolucencies here. And then we've got the distal canal right here. There you go. So the distal canal has, so there is a little bit of a shadowing in the distal canal. We can also see that there is a radiolucency around the distal aspect of the mesial canal right here exactly. And then when we move towards the 7, we also have the 7 which has a cavity on the buccal as well as the occlusal aspect. We've got very um, wide distal canal which you can see right here. A periapical radiolucency can also be seen, and then we've got the mesial canals. The mesial canals have a very weird configuration, as you can see right here. We're going to move towards the axial view or the top to bottom view for a better understanding of the distal canals, as you can see right here. We're going to zoom in for the doctor. There you go. So as we move further down, we will be able to appreciate that we've got two mesial canals very sclerosed in the 7, some radio opaque material on the mesiobuccal aspect, whereas the mesiolingual is very closed and very sclerosed here, some radio opaque material there as well. We can see significant cavitations in the lower right 6 because of the radio opaque material. However, we can also see that there is some form of a canal missed in the lower right 6. The distal lingual canal is definitely missed.